It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Welcome back. Our next guest, Dr. Christopher Breed, specializing in gynecological oncology, as well as obstetrics and gynecology. He has a very deep interest in innovative surgical techniques, developing and testing new therapeutics, also in partnering with patients for a holistic treatment of gynecologic cancers. He's with MultiCare Regional Cancer Center in Puyallup, and we're going to be talking about cervical cancer, but on a broader scope, Shannon, women's health. I mean, I know you guys treat men and women for all kinds of things and helping them to get back on their feet and or on their hands, as the case may be, at IRG, and women's health is certainly a big part of what you do.
It absolutely is, Tom. Women's health has come a long way, particularly in the physical therapy realm. I mean, we have physical therapists that's what they specialize in, the treatment of various women's health issues. And I think the interesting thing is I don't think patients and people understand how therapists can benefit those folks that need that physical therapy for intervention for women's health issues. And sometimes just not women's health, also men's health. You know, when it comes to the pelvic floor and all those areas anatomically, physical therapists can help with several issues.
Sounds good. Well, let's get to Dr. Christopher Breed. Dr. Breed, how are you?
I'm doing well. How are you doing this morning?
Doing great. Thank you for joining us on Health Talk.
Well, thank you for having me.
Tell our listeners about your practice.
I'm a gynecologic oncologist for MultiCare, and I'm out of Good Samaritan Hospital in Puyallup.
That's a very specific subspecialty. Tell us about your interest in training.
Sure. A gynecologic oncologist is OBGYN by training, so residency in OBGYN, specializing in taking care of women's reproductive health. Goes on to do additional training in how to take care of women with cancers of their gynecologic reproductive organs.
So how many years of training is that, specifically on the oncology side?
Sure. It's 4 years of residency training and a 3 to 4 year fellowship in the GYN oncology.
So you spent a lot of time in school learning your trade. What's the most exciting thing about your practice?
Well, the thing I love most about my practice is just taking care of women from time of diagnosis throughout their treatment and continuing on through surveillance and throughout their lifetimes. And, you know, I really love our patient population and what we do. And, you know, we do advanced radical surgery as well as plan for chemotherapy, administration of that chemotherapy, and so forth. And so it's really a privilege to be a part of that challenging time in people's lives.
I got to tell you, I have a lot of respect for physicians and the community of practitioners that work in oncology. The beauty of it is that you get to help people, and there's a lot of advancement in care.
It's a very exciting time to be involved in oncology in general right now, and there is so much new treatments and options available for people, and it's changing all the time.
Okay, let's talk about cervical cancer, what it is, who is susceptible. Give us kind of the lowdown on cervical cancer.
Sure. So just to review, the cervix sits at the top of the vagina, is really the entrance into the uterus or the womb. It prevents the passage of infection, allows for sperm to pass into the uterus, and dilates during childbirth to become part of the birth canal. So it plays an important part in the reproductive health cycle. And so what we're talking about with this is the cervix cells on the cervix can start to grow abnormally, this process called dysplasia. As those continue to grow abnormally, can start to invade locally, and that is what defines cancer of the cervix.
And who is at risk?
Well, we know that nearly all cervical cancers are caused by the human papillomavirus infection, so HPV. And so really the risk is risks associated with HPV infection and persistence, as well as people who have a depressed immune system for a multitude of reasons that are at risk for that infection being unchecked.
Statistically speaking, how many people are going to experience cervical cancer?
The incidence of cervical cancer in the United States is extremely low when we compare it to more developing countries. And the reason for that is we have a very robust screening program in place for cervical cancer, and that is the Pap test and women's pelvic exams, where we can actually look at the cervix and try to identify these abnormal lesions before they actually become cervical cancer. Additionally, we can talk a bit about the HPV vaccine now, where we can actually prevent the infection with the virus through a vaccination so that women don't go on to develop these abnormal cells at all. The vaccine has been available for a while now. There are several different vaccines available on the market. They either have protect against 2, 4, or 9 different strains of the HPV virus. With regard to vaccination, we do recommend starting at 11 to 12 and as early as 9. And now the FDA approval goes up to the age of 45.
All right, our conversation with Dr. Christopher Breed talking about cervical cancer will continue. We'll also have more guests coming up later in the show. Right now, though, let's take a quick break, and we'll be back after this time out right here on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
We continue our conversation with Dr. Christopher Breed, specializing in gynecological oncology and obstetrics and gynecology. Well, Dr. Breed, thank you again for joining us on Health Talk. We're talking about cervical cancer. Where do we get the information regarding the HPV vaccination or getting children vaccinated?
So that's a great question. And generally, we recommend that you start with your pediatrician or your primary health provider and ask those questions and make sure that that is a routine part of the vaccination program. And these are pretty widely available vaccinations at this point.
As far as cervical cancer goes, is there a peak or age range when it's most picked up?
Really, HPV infection is quite common, and so we estimate there are over 100 different strains of the HPV virus, and we estimate that about 80% of sexually active adults have been infected with HPV at some point in their lifetime. And so that incidence is quite high, and therefore the peak is any sexually active adult with time for the virus to infect and then start to grow a cervical cancer. The median age of diagnosis of cancer in the United States is 49, but we see an awful lot of young women diagnosed with a cervical cancer.
And what are the symptoms?
Unfortunately, for us, cervical cancer is fairly asymptomatic. There can be some symptoms associated with abnormal or irregular vaginal bleeding or discharge, particularly bleeding after intercourse, and then signs of a more advanced cancer with pelvic pressure, pain, change in the bladder or the bowel habits. Those are some of the symptoms we worry about. But with our robust screening, we're hoping that with Pap tests available that we can catch these precancerous lesions and treat those. And so the trade-off for symptomless is that we do have that good screening availability.
If you catch it early, what are the treatment possibilities?
So the treatment is based on the stage and how we catch it early. If we catch it at a precancerous lesion, we can do an excision or local destruction of those cells, and that may be enough. Unfortunately, even early cervical cancers often require more radical treatments. And so the staging is both clinical, but anyone with a diagnosis of cervical cancer should be referred to a gynecologic oncologist like myself for treatment. That gynecologic oncologist will perform staging, including things as ultrasound, MRI, PET scan to help in the diagnosis and treatment. And treatment really will vary between radical surgery, chemotherapy, radiation, and it all depends on what the presentation and stage is at the time of diagnosis.
As far as a Pap test, is that an annual physical that women should have?
That's a great question. So things have changed quite a bit in the last decade or so, and that has created a lot of confusion. It was previously annually, and as we learn more about HPV infection and its role in the development of cervical cancer, we have changed that slightly because we can now test actually for the virus that causes the abnormal cells to grow. And if the virus is not present, then we know we have time. And so we have changed those from 3 to 5 years when we include testing for that virus. And so that's a discussion that should be had with the patient's healthcare provider.
Well, Dr. Breed, great stuff. Thank you so much for your time and information today.
Sure. Well, thank you again for having me and having the opportunity to speak to your listeners and share this very important topic. Thank you again for having me.
That's been Dr. Christopher Breed, specializing in gynecological oncology and obstetrics and gynecology at MultiCare Regional Cancer Center in Puyallup. You can get more information at multicare.org. And I guess it speaks to cervical cancer, Shannon, as we learned a lot more about that today. What Dr. Breed does is pretty cutting edge. I mean, this guy's got some new therapeutics he's been working with and it's encouraging.
That's so great about having these folks on this show is learning all the advancements and the possibilities out there for treatment of various illnesses.
All right, we're coming back with our next guest. Don't go away, right here on Como.